co-hosts from the American Public Human Services Association talking about their work. We'll talk about results for America and our work, as well as providing an overview of the What Works Toolkit. I will note you can also find the What Works Toolkit online at the bottom of the email where you received the information for this webinar. So if you'd like to peruse that as we're talking today, that resource is available. Next, we'll hear from our panelists, and we'll have time for a question and answer session with participants and our panelists. If you have questions, please do save them until that portion of the agenda, and we will be accepting at that time questions either via audio or via the chat function. Finally, after that, we'll have some closing remarks, and that will round out our agenda for the day. Let me introduce in a moment the American Public Human Services Association, but first, let me introduce all of our panelists. So we have Christina Becker from the American Public Human Services Association, Carrie Cihak, who's the Chief of Policy in King County, Deb Buffi, who's the Associate Director of Compliance and Contracts, the Department of Children, Youth, and Families in Rhode Island. Myself, I'm Jed Herrmann, Senior Policy Advisor at Results for America. We've included our contact information here, so should you have further questions after today's webinar, you can feel free to email us. We've also included this contact information again at the end of our session today as well, so you can write it down then. With that, let me introduce Christina Becker from the American Public Human Services Association to talk about a little bit about their organization and to welcome you to today's webinar as well. Christina? Christina?
Christina, you're unmuted on our end. Can you be sure to unmute yourself? Just a friendly reminder.
This is Jed Herrmann. From Results for America. Christina's having some trouble with her audio. We're gonna advance and talk a little about Results for America, and we'll circle back with Christina in a second. So if we could advance the slides on the Results for America overview, I will do that at this time. Thank you. So Results for America, we are a national nonprofit. We work with government at all levels to help them improve their use of evidence and data as tools to improve outcomes. So as you can see on this slide, our mission is to make investing in what works the new normal. We help government policymakers develop the skills and the will they need to use data and evidence as tools to improve outcomes for their constituents. There are 3 ways that we do that. I'll talk about each of them. We use standards of excellence, we do implementation assistance, we focus on mobilization. For standards of excellence, we have 3 different standards that we focus on at different levels of government. First, at the federal level, we have for the past 6 years issued our Federal Invest in What Works Standard of Excellence. This scores federal agencies on their use of evidence and data, including the people, policies, practices, systems, and programs they needed in place to effectively be able to use evidence and data to make management, policy, and budget decisions. At the state level, last year for the first time, we issued our first Investment Works State Standard of Excellence that categorized 15 different categories of questions. Again, the people, practices, policies, and programs that state governments need in place to be able to use evidence and data in their decision making. In those 15 different categories, we identified 88 best practices from 30 states on how they were implementing evidence and data in their policy making and everyday work. Finally, and through a partnership with Bloomberg Philanthropies, we run What Works Cities, which has a certification program that certifies cities for their use of evidence and data. This 50-question criteria asks cities questions about their data, evidence, and again, the people, policies, and programs they need to have in place to be able to use evidence and data in their decision making. Last year, we certified our first 9 cities for their use of evidence and data, and our process is now open, and we will be certifying additional cities to be announced this spring. In terms of implementation assistance, we do it through various ways. One, we run fellowships. We have a local government fellowship, a nonprofit fellowship, and a state education agency fellowship. These are intensive programs where we take a small cohort of fellows and work with them on improving their use of evidence and data through specific projects in their jurisdictions, as well as building their skills overall and sharing best practices with other leading jurisdictions across the country. I mentioned What Works Cities, which works with cities across the country. Through that and through our partners, we provide technical assistance to those cities to improve their use of open data, their use of behavioral insights, their use of contracting and contract management skills, some of which we'll talk about today. Finally, we do issue-based work where we focus on specific issues, for example, workforce or education work, and build that work through coalitions, which I'll talk about in a second on our next slide here. And this mobilization on issue-specific works includes articles and op-eds, briefings on Capitol Hill, Washington, D.C., and in state capitals across the country, events with leading think tanks and organizations, events such as today's webinar with the American Public Human Services Association. We published a best-selling book called Moneyball in Government, and we have a coalition of over 225 Moneyball for Government All-Stars that have a pledge to abide by our 3 principles to prioritize evidence and data in public policy decision-making. So with that, I will turn back to Christina Becker from the American Public Human Services Association to talk a little about their work. Christina?
Thank you. Can you all hear me?
Yes, we can.
All right, wonderful. Well, thank you so much for having me join this afternoon, and we're very excited to partner with Results for America on this webinar today. So just very quickly, APHSA, we are a bipartisan nonprofit membership organization, and we represent the state and also increasingly the local health and human services agencies through their top-level leadership. So that means that if you work in a state agency, your HHS secretary or commissioner is a member of APHSA. We also house 9 health and human services disciplines, and the members of those are the administrators that operate agency divisions or departments, and they are represented by the kind of red dots in our logo that you can see at the top left of your screen. And these groups include, for example, the National Association of Public Child Welfare Administrators, NAPWA, and also the IT Solutions Management Group, ISM, which represents our HHS CIOs. So our membership and work represents a broad spectrum of the HHS continuum, and we all know that data plays an important role in helping human services professionals make informed decisions, get better outcomes, and help our communities thrive. So next slide, please. Thank you. So APHSA, we focus on many areas on behalf of our members to get to the ultimate goal of thriving communities. And one of those is data-reliant and evidence-informed programs and services that can achieve better, faster results, provide more targeted interventions, address structural inequities, and reduce costs. Next slide, please. So Results for America is a key player in the world of evidence-based policy, and they've worked at all levels of government to help provide public officials with tools and skills to use data and evidence to get better results. And with the toolkit that we're going to be talking about here today, they hit on several of the themes that you can see on the slide, and these themes are the ones that we encourage our members to sort of quote-unquote pull to get better results. So the toolkit we'll talk about today will give specific recommendations on how government human service leaders can make sure that data and evidence-based models are a part of their contracting process. So we hope you'll take some time to look through that toolkit and figure out how to implement its recommendations and just look at some of the best practice examples in your everyday work. So with that, thank you again for joining us today, and I'll hand it back to Results for America and our panelists.
Great, thank you so much, Christina. We really appreciate you co-hosting today's panel today and your kind remarks about the important role of evidence and data in your work. Obviously, there's a strong overlap between the work Results for America is doing and the work that your organization does, as well as the work that all our participants on the phone are doing and on the webinar are doing today to increase outcomes and improve effectiveness in their governments. So I want to thank them especially for joining. Now I'm going to talk a little bit about our What Works toolkit, and then after that, we're going to get to hear from our panelists about how they have implemented these practices and protocols in their own jurisdictions. So the What Works toolkit, which as I mentioned, you can access on our website or in the email you received about this webinar. focuses on how governments can improve the results of their human services programs by using a more collaborative and outcome-focused process. It has 5 different recommendations. Each of these focuses on a different aspect of how this work can be completed. I will go through briefly each of these recommendations, as long with providing specific examples and best practices that jurisdictions across the country have implemented in these areas. Next slide, please. So traditionally, the issue in government compliance, and I don't have to say this to the folks who are participating today, tends to be designed for short-term outputs rather than long-term outcomes. Oftentimes, there are overlapping contracts with similar goals, so multiple departments might have a contract around homeless services or around youth services that have focused on similar activities but have slightly different measurements. And because of the volume of contracts, it's often difficult to manage these, and things tend to get recycled from year to year. So that's the issue. What is the solution to this? A solution is to focus more on outcome-focused contracts. Next slide, please. That are accessible, collaborative, and outcomes-focused. This is predicated on the idea that contract compliance is not sufficient to ensure results, rather that accessibility, flexibility, and a focus on evidence and outcomes are keys. Some ways to do this are increasing collaboration between government leaders, service providers, and the community, designing, implementing, and monitoring human service contracts. So as I mentioned, we will look at ways that innovative governments are already using these approaches. I should also say it's very likely that many of you on the phone are using these approaches, and we'd love to hear from you after the webinar through our website or by emailing info@resultsforamerica.org to hear more about the work that you all are doing on this. Next slide, please. So recommendation number 1 focuses on gathering feedback and focusing on outcomes. The simple rationale here is that collaboration with stakeholders to define shared outcome goals leads to contracts that are better and more effective and gets better results. Some key phases here are to identify the key contracts. As I mentioned, in the world of government contracting, managing every single contract every single year and updating in this way would be very difficult. So identifying the key contracts that are focused on key target populations or key outcomes is probably the best place to start. Secondly, collaborating and focusing on outcomes, using requests for information, pre-proposal conferences, technical assistance to engage stakeholders. Those are all key ways to gather feedback from both the human services provider community as well as community stakeholders. And finally, providing staff to provide oversight of these contracts is key, and we'll talk about that especially in recommendation number 5. But as we know in government, what is not managed is not done. So having key staff to manage this is very important. Next slide, please. And so we've identified some leading practices. We'll hear more about King County in a moment, but I will say we have a case study that Results for America produced about some of their work, and we have a video that we'll reference at the end here that is a video version of that case study. I'll also point to New York City that has done a lot of work with their nonprofit resiliency community to bring together city staff, nonprofits, funders, and others in the human services provider community in New York to focus on ways to improve collaboration and outcomes. And they produced a guide to collaborative communication that has a lot of great tools in it. I'll also say at this point that while we're talking mainly about human services, these types of principles are largely applicable to government procurement and contracting in general. So not just necessarily human services, so that's what this toolkit focuses on most. Next slide. I also want to highlight that we just released last week a brand new product that is building off this recommendation number 1 to engage stakeholders and increase collaboration. It's called an RFI guide, how requests for information can improve government human services contracting. This guide, which you can find on our website and will be included in the follow-up email, goes more into depth on some of the strategies that governments can use to engage nonprofit or other human service providers as well as the community in designing goals for their contracting process. Next slide, please. Recommendation number 2 focuses on breaking down government funding silos. This is about aligning funds from similar programs and how that can increase efficiency and outcomes. So the first is to review funding streams. What funds are available? Are these funds addressing priority outcomes? One way to do this is to blend funds. So identify, as I mentioned, similar programs that have different funding streams and think about ways to combine both their funding or their outcomes measurement, an output measurement, to make this more efficient for government as well as more efficient for providers as Third is streamlining these allowable uses. Many times government contracts has very stringent uses that create burdens for providers in terms of reporting or the types of activities they can do. By streamlining these uses, which can be done through blending of funds, as well as other ways that allows more flexibility to increase the ability of providers to deliver on outcomes. And finally, by focusing on the long term, it's often very difficult for providers if they have year-to-year contracts to be able to build the type of infrastructure and make the types of investments they need to appropriately track data and refine their service models. Next slide, please. Some examples of places that have done this: Bernalillo, Mexico, used an interesting structure where rather than defining specific outputs or even outcomes in a request for proposal, they simply stated a problem and asked the providers to propose different ways to solve this problem, including the model, the measurement, the outcomes. It was a great way to engage them in identifying solutions that would work while helping the county solve the problems they were looking for. San Francisco has done a lot of this work of aligning work across departments, including in their workforce area. And at the federal level, performance partnership pilots were a specific federal initiative that combined, as I said, blended a variety of funds from across federal agencies, streamlined the reporting to allow local jurisdictions to improve their efficiency and have more focused outcomes across different government funding streams. Next slide, please. Recommendation number 3, what the recommendation number 2 talks about is increasing flexibility. In exchange for that, governments need some level of assurance that the strategies that providers are proposing are going to work. And so focusing on outcomes and preferencing evidence is a way to counterbalance this by saying you can have more flexibility, but we need some level of assurance that what you're going to be doing is going to pay results. And that's where evidence, having rigorously evaluated or at least promising practices that have shown early results, is a way that governments can be assured that what the flexibility they are providing providers is in exchange resulting in outcomes that they want to achieve. So use of evidence and clear outcomes metrics are very important, including these outcome goals in request for proposals, rather than making them output focused, making them outcome focused, preferencing evidence or providing extra points or incentives or set-asides for those organizations that are using evidence-based models. And finally, promoting a more accessible process, which means using plain language, consistent timelines, whenever possible, creating repositories of RFPs that other bidders can view to look at the contract terms so that when you get to the contracting phase, those types of things aren't a surprise. The more transparency and accessibility here can increase the ability of providers to bid on contracts and to respond to RFPs and increase competitiveness. Some examples for recommendation number 3, point to the Florida Department of Juvenile Justice that has not only has a tool to assess evidence, but also has a tool to assess the fidelity to that evidence. It's a very valuable tool. Results First has done a lot of work, particularly at the state level, on cost effectiveness and models. And they have a great brief on how to use evidence in the contracting process. That's Hugh MacArthur Results First initiative. Results for America, we've done some of this work at the federal level. It can be applicable also to states and localities as well. And finally, New York City has a centralized contracting portal that addresses many of the issues I mentioned around a more accessible process. In terms of recommendation number 4, we're looking to fund outcomes and build evidence. The idea is to align incentives to reach the desired outcomes. So the different ways that can be accomplished are aligning the metrics with outcome goals. So while it's important to have some outputs occasionally in contracts to measure the medium-term or short-term achievements, it's also very important that those outcome measurements are tied to those outputs. Secondly, considering tying part of payments to outcomes. While I mentioned it's important to provide funds so that nonprofits or other providers can build the infrastructure they need to provide the services, it's also worth considering whether some portion of the payments can be tied as performance payments or bonus payments or contingent upon achieving certain outcomes or longer-term outputs towards those outcomes. Including the use of data in contracts, so collecting, integrating, and sharing data, making sure that providers will do that, and also thinking about the role of government in doing that, which we'll talk about in a second. Incentivizing the use of evidence by requiring, and whenever possible, funding evaluations so that providers can evaluate and continuously improve their interventions to move towards better outcomes. And finally, using a consistent payment process where payments and providers can count on those payments being consistently issued, using systems and templates that allow staff to focus on outcomes monitoring and not payment processing, which can be very time consuming. Some best practice examples for recommendation number 4. We'll hear about King County shortly and their Best Starts for Kids initiative and how they've done some of this work. I mentioned sort of incentive payments. The Pennsylvania Department of Corrections has done this for providers that reach outcome goals. They get an increase in their per diem rate. New York City, through its nonprofit resiliency initiative, has made very transparent a lot of these tools and used a consistent process by putting things like the payment advance policy and claims verification guide and using their central passport system to make this process as seamless as possible for providers. And then I'll mention the Harvard Government Performance Lab, which is a great tool for sample contracts. And I'll mention later in recommendation number 5 some of the work they have done as well. Going on to recommendation number 5 there. This is about creating feedback loops. So the idea is that in the past, many governments, the outcome was the production of a contract. So once a contract was signed, many governments thought that their work was done and that they would get their results in a year or 2 years. This idea is focused, saying that the contract and the signing of the contract is just the beginning of the work. And so having active contract management, which is a term that Harvard Government Performance Lab uses, to talk about these regular feedback loops that are occurring. This happens with government soliciting and nonprofits providing frequent updates on the program progress and interim goals. This allows for course corrections, continuous improvement, and movement towards the outcomes that the government and the nonprofits, providers, or other providers have identified as key here. So that requires regularly monitoring progress, that is regular meetings, collaborative meetings, including sharing of data through shared data systems. So thinking in advance about what kind of data is going to be needed, making sure we're sharing it in the initial phases in the first recommendations, and then using that in this stage to identify progress towards the shared goals. And finally, sharing regular performance data, operational output and outcome data to stay on course. This information can also be shared with the public through portals or other ways that the public can also stay on top of what goals are being achieved. In terms of best practices for number 5, here, we'll talk in a second. I mentioned King County again. New York City is an internal data sharing forum. There's a great data access and integration toolkit that Robert Dorr and Linda Gibbs have put together to talk about very detailed strategies and examples that organizations can use to use administrative data to both assess the quality of their programs and to monitor the quality of their programs. And finally, I mentioned that Harvard Government Performance Lab has a large body of work on active contract management, and we'll hear more about that from our panelists in a moment. Moving on to our panelists, I want to introduce Deb Buffi, who is the Associate Director of Contracts and Compliance at the Rhode Island Department of Children and Families. And Deb, I have just a quick question for you. Maybe you can start by just telling us a little bit about the Rhode Island Department of Children, Youth, and Families and the work that you all do there. Deb?
Sure. Hi, Jed. Hello, everyone. I'm so excited. The toolkit sounds awesome, and we were fortunate enough to have the Harvard Government Performance Lab assist us with a lot of the different things I'm going to talk with you about. So it's really exciting to be here. DCYF, the Department of Children, Youth, and Families, is the child welfare agency in Rhode Island. We're the unified state agency with the responsibility for child welfare, children's behavioral health, and juvenile corrections. Our budget is about $209 million, and we have about 3,200 children open to DCYF at this time, 600 or so in juvenile probation, and we also have a certain amount of kids at our Rhode Island training school. So in talking a little bit about DCYF in the context of the webinar, back in January of 2015, and you can see from the slide up here, we were faced with concerning outcomes for children and families. We have a slide there where we were like the 4th highest in the country in terms of the numbers of kids in group settings. We were about the 30% range, which obviously is concerning. We had a number of contracts in 2015 with our service providers. Many of the contracts were non-competitive contracts. They were all paid on a 1/12 annual amount basis. There were no real ties to outcomes. People used good faith to enter into those contracts, but DCYF at the time had what is called delegated authority. So therefore, we really did not have to do a competitive bid. And I think that had a huge impact on the types of contracts that DCYF had at that time. And as one would imagine, budget overruns, and at that time we had limited coordination between the service delivery, the invoice payment, and contract management.
Thanks, Deb. Could you tell us a little bit, that's a great overview. Could you tell us a little bit how you reformed the contracting process using data and a focus on outcomes?
Oh my gosh, it was huge. So what you're looking at on the screen is like a sample of the RFP that we drafted. And again, you know, our partners at Harvard were very helpful to us, and DCYF is very appreciative. But what we did in our RFP was it was completely based on outcomes. We put it all out there. It's like, these are the outcomes we need to meet, and this is what we want to hear from our providers. And I think, you know, what that resulted in is about 185 proposals, and they were, I mean, most of them predominantly were great, that we were creative. They told us how they were going to meet the outcomes. They were competitive, and it was great. And it provided for us the ability to enter into about 116 contracts, which were outcome-based.
Well, great. Thanks, Deb. That's a great overview. And actually, that is a great segue to introducing Carrie Cihak from King County, which is the county in Washington that includes Seattle. Carrie, I know that actually the first recommendation in the toolkits talks a lot about gathering feedback and focusing on outcomes. Deb talked about how they've done that in Rhode Island. Can you talk about the community engagement work that you all did, Best Starts for Kids, and how you conducted that and how that influenced the Best Starts for Kids initiative?
Absolutely. Hi, everybody. Happy to be talking to you here from very snowy Seattle. Let me tell you a little bit about our Best Starts for Kids work to set the context. Jed mentioned there's a case study by Results for America that's really a companion to the What Works toolkit, and I'd recommend that you take a look at that. But on the next slide, you'll see a little overview of Best Starts for Kids, which is a property tax levy, $65 million a year, that builds on the strengths of families and communities in King County. And we really started with the outcomes that we wanted to achieve for children and youth in the county. So babies being born healthy, the journey to adulthood being healthy and safe, and building a supportive environment in our communities around kids. The percentages there are how the funding is allocated, and we were really excited to have a 5% set aside for data and evaluation to support us getting to those outcomes. I'd recommend that you take a look at the video that Results for America produced, where you can hear directly from some of our clients, our service providers, staff, and our county executive himself, Dow Constantine, talk about Best Starts for Kids. So in terms of the issues and solutions we were facing, we really just weren't achieving the kinds of outcomes that we wanted for children in our communities. We have very deep inequities by place and race across King County, and we wanted to use this focus on outcomes as a way to improve the ability of everyone in our community to achieve their full potential. So one of the ways that we hope to achieve those big Best Starts for Kids outcomes was through redesigning our contracting process. We wanted to engage a broader range of organizations in delivering services. We were, really, a lot of our contracts were with very large organizations, and we weren't really reaching many of the communities that we needed to. And we also wanted to invest, of course, in evidence-based practices, but also build new practices and innovations and build the evidence. And reducing the risk of investing in innovations through collaboration with and among the service providers. So it's really a partnership. It's not an information transfer from the county to the community. It's a partnership between providers in the county in achieving the BSK outcomes. So some of the ways on the next slide, you'll see that we conducted our community engagement. It wasn't just a point in time or a single activity, but really a continual process of engaging with the community in partnership, and it's baked into everything that we do. So we've been out in the community in successive rounds of engagement. So it started with developing those top line Best Starts for Kids outcomes that you saw in an earlier slide that were on the ballot proposal. Then working with the community to define the implementation plan, our data indicators and measures, and our Best Starts for Kids Child Health Survey, engaging the community in requests for proposals, and also in ongoing monitoring and evaluation. And on the next slide, you'll see some of the new avenues that we developed to undertake that community engagement. We had an expert panel. We established a Children and Youth Advisory board. We have a very active Best Starts for Kids blog, which is a central repository of all the information about the initiative. We've had a big focus on community-owned data, and the picture that you see there is one of our data deep dives with our Somali community. And one thing we learned from the community was that our regular contracting process itself was a real barrier, so we devised some ways to really open that up through pre-bid information sessions, much as described in the new RFA guide on requests for information, providing a lot of free technical assistance, and conducting monthly learning circles with our service providers. So the result of all of that was really bigger and bolder than we could have ever imagined. We learned more from the community, I am certain, than they learned from us. And it really resulted both in some innovative strategies. For example, based on all that community engagement, we added a strategy around ending the school to prison pipeline. So it was just the strategies, but also the innovative ideas for implementation that communities proposed. And you can see a picture here of 2 middle school students who are leading a professional development workshop for the Seattle School District on implicit bias. And not only through the community engagement and outcomes focus, we really were able to engage with more organizations throughout the county and really work deeply in community in ways that we have never been able to do before. So just from one of our RFPs, the preliminary results show that we had 124 organizations who accessed technical assistance in applying for that RFP. And of those, over half had never applied for King County funding before, and a third had never applied for any grant before. So we're really developing much deeper and stronger relationships in our community, and we are certain that's going to produce better outcomes and results.
Well, thank you, Carrie. That's a great summary of the work that King County has done on the front end to make sure they have an inclusive and open contracting process that engages communities that traditionally have not been engaged in this work. Deb, turning to you for a second, talking a little bit more about the back end of the process. So once you've got these folks in the door and you've got your outcome-focused contracts and RFPs, talk to us a little bit how you use feedback loops with providers to continually improve these services and make sure you're actually achieving the outcome goals that you laid out at the outset.
Sure, that's the best part. So yes, we engage in active contract management, and I was fortunate enough to be part of a pilot that began in 2016. And what we did was we engaged our, at the time, 4 family care community partnership agencies. Total budget of the 4 agencies is about a little over $6 million. And the function of these agencies was to work with families in the community to divert from involvement with the child welfare program, with DCYF, very critical function in the community. So the active contract management process is just really exciting. We engage with our providers. It's data-driven, it's collaborative, and it's action-oriented. And we started out meeting on a regular basis. We looked at data, real-time data, entering data in a reliable, timely manner, using data analysis to work with the teams in the room so they could look at their performance, so we could ask questions, so that the providers can learn from each other. We created a safe atmosphere whereby the providers could be in the room together and actually problem solve about what things really worked and how they could really deliver good results. We've been doing it for 2 years with these particular providers. It's just such a rewarding experience. We meet regularly, we look at the data regularly, we talk about the data, and we get excited about the good results. And I think on your screen right now, you have a sample of the data that we look at, and we're just so excited. Our 5 community agencies have the responsibility to complete assessments for the families. And you could see at the portion of the screen on the left, when we started active contract management back in the beginning of 2016, the completion rate of assessments was down around that 30% or lower. And the past 18 months, 2 years that we've been engaged in active contract management, our percentage of assessments completed many times is 100% and definitely is around the 80 or 90% on a regular basis. And those are results we're collectively very, very proud, and the families benefit. If you look at the portion of the screen to the right, this is critical. This is where we track, okay, who is a family who is open to the FCCP, Family Care Community Partnership Agency, who received services, and did they ultimately end up opening up to DCYF? We've been tracking this. This is probably the most important piece of data we need to look at for these contracts and these providers. And you can see very clearly looking at the chart, we went from the 12% down to 2%, 3% of families who open up to the Child Welfare Agency, DCYF, here in Rhode Island. We're just really proud of this data and these results. And we're proud with the providers. I think that's the real exciting part. And literally, when we show this data up on the screen, we all clap in the room because we're all jointly excited that the families and kids in Rhode Island are really the ones to benefit.
Wow, Deb, that's great. Thank you for sharing that. It's a real great example of how feedback loops can help you meet your outcome goals and providers at the same time, since you all are sharing in those desired outcomes and meeting regularly to achieve those goals. Just for folks on today's webinar that aren't too familiar with this process, maybe you could talk to us a little about what's the difference between a regular meeting. You know, we've all been in government. We have regular data meetings all the time with contractors. What's the difference between sort of a regular data meeting that might normally be conducted and an active contract management type of data meeting?
Yeah, well, I think that's something to be very thoughtful about. And you're looking at a slide up here, is you're always looking at real-time data, so the data is as relevant as it can be, you know, really timely, so you have the opportunity to react. It's operationally purposeful. We have our questions that are very thought-provoking. So it's not just put the data up on the screen and somebody at DCYF talks at you about it, and I say that in a very respectful way because we all have good intentions, but it's not about like talking to the providers. It's really getting their reaction and their desire to want to see their data improve, and that leads you to the action oriented. And I think one of the greatest things, a couple of the greatest things that I think we've seen is that the providers themselves really learn from the other providers in the room, And also, they're not concerned when their data might not look that great for that particular month, because they know that we can talk about it in an environment that's not a gotcha environment. And I think the biggest difference between a data meeting and active contract management is the iterative part and the thought-provoking questions. I think that is the biggest difference, and to really engage the providers and to get them to want to perform great results.
Great, thanks, Deb. Thanks for answering that. I will note you mentioned the Harvard Government Performance Lab. I will note that Scott Kleinman, who has worked very closely with you on this, is on the phone. And so when we get to the question and answer portion, which we'll do in just a couple of minutes, if people on the phone or on the webinar have questions, Scott could be available to answer those from the Harvard Government Performance Lab. But before we go to our Q&A, I want to go back to you, Carrie, and ask, Deb, I think, has done a great job about talking about, and you did as well, sort of what happens at the front end in terms of engaging providers. Deb's talked a little about the back end, about these feedback loops, but I know that King County and Best Starts for Kids has really done a lot of work in the other areas of recommendations in the toolkit as well. So could you describe how you've implemented some of the other recommendations from the What Works toolkit and how they're reflected in the Best Starts for Kids initiative, Carrie?
Absolutely, and it was really great to hear from Deb. A lot of what she said really resonated with me and the work that we're doing in King County as well. So I pulled together just a few ways we've implemented some of the other recommendations in the What Works toolkit. So for recommendation number 3, I mentioned that what we heard from the community was really that our RFP process itself was really standing in the way of communities participating and helping us achieve outcomes. So we really went through a complete kind of redraft of our request for proposal process to really focus on those outcomes and include evidence and data work in our RFPs. So, a lot of times our requests for proposals have a lot of bureaucratic language in them, and we really focused on the outcomes and put those right up front in the RFP. We did some pretty simple things like including a table of contents and a simple checklist for folks to make sure they were meeting all the requirements, using plain language. We eliminated a lot of outdated bureaucratic requirements, such as bringing a CD-ROM down to the downtown county offices. We preferenced use of our Best Starts for Kids indicators and applications, really pushed folks towards our indicator site and asked them to include that data in their responses. We did a lot of pre-bid conferences to talk with people in the community about the process, and we have a lot of free technical assistance that's available. And then we also include community representatives directly in the RFP writing and in the selection process. And we require all of our selection panelists to go through a pretty intensive implicit bias training when they're participating in our RFP selection panels. In terms of recommendation number 4, funding outcomes and building evidence, we, in the contracts directly, we use the outcome measures that we've developed with service providers, and we include performance measures that they help us define as well. We require data collection and sharing from service providers. We're using the contracts to build capacity in many of these very small community-based organizations. It's unrealistic, I think, to expect that small community-based organizations are going to be able to actively use data and evidence unless we build their capacity to do so. So we're investing in that. We have 1-year contracts, but we have really focused on anticipating 3-year funding horizons with annual renewals that give us adaptability and flexibility. And we're investing both in the evidence-based practices, but also evidence-building innovative practices. And then for the 5th recommendation, creating feedback loops, a lot of what Deb talked about in terms of that active contract management is also a focus here in King County. we very much moved from a culture of coaching to compliance, moved to a culture of coaching to compliance from trying to catch people out of compliance, and really working on contract management as a partnership between our Best Starts for Kids program managers and the service providers, both individually and collectively as a group. So a lot of communication regularly happening between and among contract managers and service providers. A lot of that data sharing that you saw Deb reference, we're also doing with our service providers, doing that through monthly learning circles as well as one-on-one conversations. And again, really approaching this as an investment by both the county and the service organizations in achieving those outcomes. We both have a huge stake in getting to those outcomes, and we can both learn and support each other in that work.
Well, thank you, Carrie. That's a great summary of the work that you've done in King County, and very complimentary, I think, to Deb's discussion of the work they've done in Rhode Island. In just one moment, we're going to turn to our question and answer portion, where we'd love to hear from participants about questions they have for any of our panelists. I also mentioned that Scott Kleiman from the Harvard Government Performance Lab is on as well, and so is available to ask questions. I just want to briefly summarize and thank our panelists. I think we heard a lot of recurring themes here related to communication and collaboration with providers, related to setting outcome goals that both providers and the government are working to achieve together, the importance of feedback loops, and creating an accessible process where people are able to be engaged, and to increase the number of providers that can be engaged, the diversity of those providers, and hence the competitiveness of the people that are bidding on contracts. So just want to highlight those themes. And now I'm going to turn it over to Sophie Bergman from our Results for America team to just give some technical details on how we're going to do the question and answer portion of our conversation here today. Sophie?
Hi, everyone. So as Jed mentioned, we're now moving to the Q&A portion of the webinar. So we will be maintaining a queue of questions and asking the questions to the panelists as we receive them. In order to ask questions, you have two options. First, you can use the chat feature to ask your question to the panelists in the lower right-hand corner of your screen. And then you can also click the raise hand button on the right side of the screen. Once we see your hand go up, we'll add you to a question queue. And when it's your turn, we'll call on you and unmute your microphone so that you can ask your question. A friendly reminder to also make sure that you're unmuted on your end so that we can be sure and hear you. When you do share your question, please state your name and organization. And then for those of you on the phone, please send any questions to info@results4america.org. Again, info@results4america.org, and we'll be monitoring that. And with that, let's get started. And we'll give a minute or two for questions to come in.
Okay, Sophie, do we have a first question?
Yes, great. We have a question from Janine Moore. What did the providers state was the key to the improvement in their outcomes?
Deb, perhaps you want to start with that one and talking about your work in Rhode Island and that you were able to achieve, as you showed on the slide, there are some great improvements with providers and the work they were doing. What have they stated in your meetings were sort of the key to achieving those outcomes and that improvement?
Okay. So I'm sorry, Jed, could you just repeat it one more time, please?
Yep. So what did the providers state was the key to improvement in their outcomes in your work with them?
Oh my gosh. Well, basically it was the things that we just spoke about. They're very dedicated to the very regular meetings. And I think that an atmosphere that they can feel comfortable asking questions, questioning their data. I think the two most important things the providers would say is a very non-threatening atmosphere where they feel very comfortable to fail if they do, and to figure out why they failed, and to look and to listen to their peers and their colleagues as to how they can improve. So, and secondly, well, there's a lot of things. They would also say that to get that that feedback loop, like to really get accountability from DCYF, get the answers they need to be able to look at the data and improve. I think it's the atmosphere, the real-time data, their ability to feel comfortable, their ability to understand what's expected of them, and to feel valued, and that we're in this together.
Wonderful. Thank you, Deb. That's great. Let's go to our next question. Sophie, what do we have?
Great. We have a question from Jerry Cotter. Are there sample outcome-based agreements and RFPs available to be shared?
Great. This is Jed Herrmann from Results for America. I'll take that. There are a couple of places you can find this information. First, if you go online, you look at the What Works Toolkit. All of the things that were mentioned today are linked in there, and there are hyperlinks to each of those samples. I would also highlight one of the things, I mentioned before, the Harvard Government Performance Lab, which is highlighted in the slides here, has a great repository of sample RFPs and RFIs. And thirdly, the new Request for Information guide that Results for America has just put out in partnership with Project Evident also has some links to specific materials. And so those are three great resources, all of which are available by going online and looking at the What Works Toolkit on the Results for America website. Next question, Sophie.
Great. This is from Kelly. Carrie, did you develop your own implicit bias training for your RFP evaluators, or do you use an quote-unquote off-the-shelf training?
We developed our own. We have a quite extensive work in King County around what we call equity and social justice work, and have been doing a lot of implicit bias training in our hiring processes, and that gave us a really great foundation to develop an implicit bias training for our RFP selection panel. We'd be happy to share what materials we have on that. And I'll also just add on the previous question about the RFPs, if you just do a Google search for Best Starts for Kids RFPs, we've really made it a priority to have a lot of transparency around our RFPs. So you'll find a lot of sample RFPs or actual RFPs there on our Best Starts for Kids blog too.
Great. Ryan Marshall has asked, we tend to collect outcome data on an annual or semi-annual basis. Part of the reason that we do this is to minimize administrative burden on our service providers. How did you all work with providers to build the will to engage in more active, regular use of data despite the increased administrative work?
That's a really great question, Ryan. I think at the heart of a lot of what we're talking about here, both on the contract management end and on collaboration overall. So why don't we start with Deb, because I know that she talked a lot about this.
Yeah, I mean, thank you, Jed. That's a very good question. We were fortunate that the 5 contracts that I'm specifically talking about today, we had built a database with them, a case management database, where we supported financially the database, the programming of the database, and we actually provide the support for the person who pulls the data. So in that respect, it's minimal impact on them. So I do think that's an excellent question. But what I will say is when we move beyond those FCCP contracts that I've spoken about at DCYF, we also are in a good place with the data that we have here and the data staff that we have at DCYF, because we're an agency that continually will be looking at the data and asking for the data. I think that's a good question. I think you're right to think about what is the best way to facilitate the providers gaining the access to the data with ease. I think it's important to think about that.
Great, thank you so much. Carrie, do you have anything to add on this front?
Yeah, similar to what Deb said, we have invested in the capacity of many of our community-based organizations to be working with data. We undertake a lot of the work centrally, so defining the the Best Starts for Kids indicators, and all of the work around that is done out of our public health department. But we've invested in capacity in the community-based organizations to work with that data. And, you know, I'll also say that one of the things that's been really important for us is we started with those real top-line Best Starts for Kids indicators. Some of those outcomes, you know, those are generational. We're not going to see big movements in those, even perhaps on an annual basis. So what's really been important for us in creating that outcomes focus and the focus on evidence is a results-based accountability model to move from those big top-line community outcomes down to the very specific actions with a very well-defined theory of change and accountabilities throughout that model. So that allows us to look at different kinds of data that we can update more frequently. Some of that data is coming directly from community-based organizations, and some of that data is data that we're collecting and looking at and sharing centrally.
Great, Carrie, thank you. I'm going to ask Scott Kleinman from the Harvard Government Performance Lab to jump in here too. And I see we have received some other questions over the chat feature as well about just generally, how do you get this data? How do you get providers to do this, especially if it hasn't been done before? Scott, do you want to talk just a little bit about some of your tips and the work that you all have done in this area?
Yeah, thanks so much, Jed. This is Scott Kleinman from the Harvard Government Performance Lab, and we've been involved with Rhode Island and a bunch of these other jurisdictions around the country. Just building on what is said, a couple in addition examples. So in the example Deb's talking about with the FCCPs, one of the things that the department did was eliminate the burden associated with longstanding reports that were no longer being used. So 2 reports that providers had to fill out for each case were combined into one. That dramatically reduced their obligations, and then there were some other things like eliminating narrative reports is often something that jurisdictions that take a lot of time for providers and typically aren't actually used by governments to drive change. The second part of making the case to providers to do a little bit of extra work around reporting data is helping them close the loop. One of the things that that DCYF heard again and again from providers was that many providers don't know what happened to their clients long term. So for a family served by the prevention program that Deb was describing, their goal is to keep that family out of the child welfare system long term, but once they close that case, they don't know what happens. And so part of this, part of being involved in this is giving them visibility into the long-term outcomes of their clients, which allows them then to go back and make adjustments to their program based upon learning what clients were successful and what clients weren't.
That's great, Scott. Thank you for sharing that. I will also note, there is a level of support and engagement. This type of feedback loops and engagement providers is a different way of thinking. And so it is important to think about how you're using your resources and how the provider is using your resources to be able to do this work. As Scott said, that may mean reprogramming of tasks they had been doing on reports that aren't being used, or streamlining administrative burdens or other requirements, but it does take a different orientation and resource alignment to try to do some of this work. Thank you very much, Scott, for sharing that perspective and from the great work you've done in Rhode Island and other places. Sophie, do we have the next question?
Great, yes. Gary Hammer mentioned that there was a slide that showed a goal matrix for inclusion in an RFP, perhaps from King County. Is this available for sharing?
I would just say, before Carrie jumps in there, that on the last slide here and at the beginning, we'll share contact information for each of the panelists and presenters on today's call. So if people have specific questions, they can feel free to follow up individually. I'll also note that, as I said previously, we're recording this webinar, so we'll send that out along with links to the What Works toolkits and some of the other materials we've discussed today via email to folks so they can have that information as well. Carrie, is there anything you wanted to add on that before we go to the next question?
I think the goal matrix was actually the work that Deb did with the Harvard Performance Lab, but again, if you go to our Best Starts for Kids website and search around there, you can find how we move from the big Best Starts for Kids outcomes down to goals and strategies, and then how those link to our RFPs. So we've done similar work to bring that work all together into a really thoughtful model.
Great. Anything you want to add there, Deb?
No, I think, yes, I think it was on Matrix, and yeah, we're happy to share it. You know, that is part of the RFP, which was a public document as well, so sure.
Perfect. Thank you so much. Sophie, do we have additional questions?
Yeah. Chris Mathias asked, can you please speak to how you were able to get real-time data, and what platforms or systems did you use to get this up and running?
Deb, do you want to start there, or ask Scott if he wants to?
Sure, if Scott can weigh in. I mean, I think I pretty much answered it a little bit earlier, that separate kind of case management database that we have, that we provided for those family care community partnership agencies can be, you know, real time. You have data in and data out. So that's predominantly what we've done with respect to the FCCPs. And I don't know if Scott wants to add anything.
Scott, anything you want to add?
Yeah, I will add. So we often start with what are the operational questions that you want to answer, and we found often the data you need to do the first series of conversations is pretty simple. So often it's for a social service program, it's referral and enrollment information. And that's something that even if you don't have a robust data system, you can pull together an Excel spreadsheet that tracks who you refer to a program, the date the referral, and it's pretty easy to get providers to report back who of those folks who has been enrolled in programs. And in fact, we found often for programs that providers bill to departments on a per day basis, you can also often just look in billing data, and if invoices are designed in a per client way, you often don't need to look for additional information. In applying active contract management strategies to group home contracts, where it's really important in the child welfare context for group placements and group home for kids to be short, temporary, and clinically rigorous, looking at lengths of stay is really important. And that was another place where the department has been able to use billing data that it collects from providers already through the invoices, and use that to generate an operationally relevant dashboard about the share of kiddos who successfully exit group care within the time period that the department has organized for having conversations about success.
Wonderful. Thanks so much, Scott. That's very helpful. Sophie, do we have maybe time for one or two more questions? What's our next question?
Spencer Hall asked, what has the impact of outcome-based contracts been on your budget? Are you paying more, less, or the same for the services provided?
Deb or Carrie, would you like to take that one?
I'll jump in on this one. I think if you look at the overall DCYF budget, you know, the same or more overall. But when you look at our contracts, from my perspective as the contract and compliance officer, if you will, I believe we're getting more bang for our buck. And so I don't know that we can say we're seeing like these dramatic decreases in our budget. However, we are definitely getting better results.
Carrie or Scott, I don't know if you want to speak to that.
Yeah, I'll just echo Deb's experience. I think the most relevant area related to this question for us is around our homelessness services, and we're investing more in homelessness as the problems have grown larger. through the reforms in the system and the focus on outcomes rather than inputs and outputs, we're getting much, much better results. We're exiting more people out of homelessness quicker and into permanent supportive. Now the problem is still growing on the input side. More people are entering into homelessness as our population grows and rents are increasing and all of that, but we're overall getting much better results out of the system.
And Jed, I'll just add, I think one striking thing as you look both in Rhode Island, but this is increasingly a trend, is that performance payments often are using only a really tiny share of the overall contract value. So often less than 5% or even 1%. But tying just that small amount of payment to longer term outcomes institutionalize these longer term feedback loops where government is telling providers what happened to clients after care concludes, and often 3 or 6 or 12 months later. And it also makes really explicit to everybody ultimately what the purpose of the contract is and what success looks like for a program that often can be ambiguous without some sort of small linkage to payment. But in the end, these are often really almost micro performance payments, we sometimes call them.
That's great, Scott. Thanks for sharing. I think that highlights the important role for allowing providers to build infrastructure while at the same time incentivizing this move towards outcomes. So I think that balance, as you highlighted, is key. I think, Sophie, we have time for one more question.
Yep, one last one. We convene pre-proposal conferences, but otherwise limit technical assistance provided once RFPs have been released. I'm interested if any of the panelists ran into fairness concerns from stakeholders related to providing technical assistance to proposers.
Carrie, do you want to start with that one?
Yeah, I think because our focus has been continuous engagement with the community all along the way, and very transparent and open processes that are more accessible to everyone, that hasn't been a significant problem for us. We've also, through the focus on our community engagement from the get-go, we've dramatically expanded the number of organizations who are participating in our work. So I'm sure that has led to people, feeling like it's been a pretty good process.
And I'll just add, this is Jed Herrmann, that our latest publication on Request for Information Guide lays out some ways that folks can be very thoughtful throughout the procurement process on how they collaborate with providers. It includes some templates, as well as some sample questions and checklists that people can use to collaborate throughout the procurement process. So I will note that many jurisdictions do have a restriction on the types of support that can be provided once the RFP is released, but there are plenty of opportunities to do that before the RFP, and as Carrie highlights, if that's done consistently or equally after the RFP has been released, depending on this jurisdiction, that can also be a very helpful approach.
And Jed, one example I know of is City of Boston, when they were rebuilding their website, I believe, invited providers to a day-long hackathon where they had a collaborative build-out and problem-solving conversation that was open to all providers to come and spend the day and really understand what were the specific needs that this city was trying to accomplish. And I think is a particularly interesting example of addressing some of the challenges around open access in this pre-bid stage. That was the City of Boston.
I'll also just add that we have baked in biases in our current kind of traditional request for proposal and processes. And so our focus has really been breaking down those biases and barriers and opening up the process to make it more accessible for everybody, and particularly for organizations for whom it hasn't really been accessible in the past. So that's the real focus.
Well, great. Thank you so much. It's been a great question and answer. Some very thoughtful questions from our participants on today's webinar. Some great answers from our panelists. I want to thank Carrie and Deb and Scott, as well as Sophie from our team and Quinn from our team, who are helping manage this in the background. On the screen there, you can see the contact information from each of the people that has participated on today's webinar. So if you have follow-up questions, please feel free to email us and ask those questions. As I noted, we'll also be sending out a follow-up email that contain the materials we've mentioned on today's call. I want to turn it over to Christina from the American Public Human Services Association to close us out today, and thank her for co-hosting today's webinar with us. Christina?
Yeah, thank you, Jed, and thank you again for everyone for joining and taking the time out of your day to participate in this. As Jed said, please feel free to reach out to any one of us with any questions that you may have, and follow-up materials will be sent out, including the slides. Thank you, Jed.
Thank you, Christina. Thank you, everyone, for joining today. Really appreciate taking the chance to do that. I do also want to note, as I mentioned up top, that there is a video that is the video version of the Best Starts for Kids King County case study. The address is on your screen there. We'll include a link to it in the follow-up email that we send. I want to encourage people to watch that, as it really puts in living color some of the examples and information we've talked about today. And finally, I want to thank all the participants for joining today. It's been a very stimulating conversation. I know all of you on the phone and on the webinar, like us, are committed to improving outcomes from government human services contracting. I know a lot of you out there are already doing this work, and so I want to thank you for that and how challenging it can be to implement these types of innovative strategies. We hope that our work at Results for America to help you do that, to help you build the skills and the will, is helpful, that the recommendations in this toolkit are of use to you. And again, if you have suggestions or ideas or follow-up information, please feel free to do an email with us as a follow-up. Thank you so much, and enjoy the rest of your day. Bye-bye.
Thank you.
Bye, everybody. Thank you.